So, David, how was the American College of Physicians Council of Specialty Societies meeting?
It was an excellent meeting, and I think it really did give the community a chance to come together as we move through the ongoing parts of the pandemic and look at the issues that remain really important, both pre-pandemic and post-pandemic, or at least currently in the pandemic, to deal with really how physicians are faring in the universe that we exist in right now. So I thought it was a really robust conversation.
Yeah, and it's interesting because I think just to frame the role of the Council of Specialty Societies for our listeners, the broadest kind of platform, if you will, is probably the American Medical Association's House of Delegates, which includes, all the subspecialties in medicine. Then you have the Council of Medical Specialty Societies, which includes most of them, but is a little narrower because in general, there's only one specialty society, there's only one society per specialty. Then you have, for us, as we think about the internal medicine community, all the internal medicine specialties as recognized by the American Board of Internal Medicine included in this American College of Physicians Council of Specialty Societies. And then if we think of this as sort of concentric circles, then you have sort of two other directions. One would be, kidney and nephrology or possibly even transplant specific coalitions. You have a set that are more issue specific, such as, research issues or medical education issues, et cetera. And so one of the challenges for ASN, and I know you spent a lot of time on this, as do other members of our staff, and in this case, ASN Secretary Deidre Cruz, who's our representative to CSS. You're at every meeting, you're involved in all the calls, you're part of the email exchanges, et cetera. So does that seem like a reasonable summary of our kind of environment or our galaxy, if you will?
Yeah, Todd, I think it really does capture it very well. If you're talking about a galaxy, there are little clusters in solar systems of certain coalitions around particular issues, whether it's dialysis, home dialysis, or something else of that nature. But I think that captures the big picture.
So in terms of the recent CSS meeting, I'm just sort of curious about the agenda. And I know one of the big topics, and you mentioned a lot of the discussion was around the effect of the COVID-19 pandemic on healthcare in the United States. How did the discussion about physician well-being and increasing burnout and the effect of electronic health records and other technologies on the delivery of care? Just curious as to how that conversation went.
It was a very good conversation. I mean, there was a part of it that was it would make sense for healthcare professionals groups to try to get their hands around, which was ways in which to kind of give a rating, give a metric to kind of how physicians are faring, and what are the conditions and what are the factors that are having the most influence. So there's some of that I always in that kind of situation feel like there's some amount of that makes sense, and some of that you take with a little bit of a grain of salt. But I think everyone made some really good work out, kind of making inroads into that. And one of the things that you mentioned was electronic health records. And I sometimes go back and forth. So excuse me, medical records or health records, but the EMRs or EHRs have absolutely unequivocally had a major impact on physician well-being for many in terms of just how much stress it is placed on them. And you can't really separate all of it out because you do that in the midst of a situation with really increased workforce shortages, which would make the activities of things of that nature even more burdensome when there's fewer shoulders to spread it around on for everyone to support. So the conditions that have existed and have been coming along for quite some time now, as we see shortages looming, but also that have really been exacerbated by COVID, have definitely come to bear on a lot of different groups in terms of different physicians and different areas.
So help me understand the advantage to ASN in terms of working with the Council of Specialty Societies within ACP or a broader coalition like the Council of Medical Specialty Societies on the issue of physician well-being.
I think it's a very, very, very healthy comparison to make about having that conversation elsewhere. It can be very, it can be very difficult sometimes in any particular subspecialty. In nephrology, we have some of the issues that we all know about. There's been a large challenge in COVID of just keeping dialysis facilities maintained at the level that could accommodate everyone who needs the services they need. With really we've had shortages of individuals and we've had shortages of supplies. And it's easy to kind of see yourself in a situation where you just don't know if everyone around outside of your space really understands what you're going through, which I think as human beings, that is always that isolation in wellness. It can always be very harmful if you're not sure that anyone really cares or is aware of what it is that you're struggling with. I think that when you get into this situation, you get to see how other groups are dealing with it. And you also do get there was a couple individual societies representatives who spoke directly to just how difficult some of these things were in the renal space at the moment. And they acknowledged that, particularly around labor shortages and certain other cost cutting efforts within the government could really be stressful. And so that gave us all a chance to remember that we are in a collective field of healthcare. And also because of some of the things that have been structured, like, let's say, budget neutrality for things within Medicare, it's easy for, everyone to be kind of like, feel as though they're sidelined and that they're battling each other in healthcare, as opposed to saying, how are we going to get around this? I mean, on healthcare shortages, we've got like 6-7 major pieces of legislation right now that are in Congress. So it gives us a chance to see what a greater, a larger, stronger, more unified voice might accomplish.
So you mentioned that there was attention paid to the kidney community from other specialties within internal medicine. What were the other issues on the agenda that also other specialties recognized that nephrology was uniquely positioned to contribute in a meaningful way?
The conversation of well-being took a good portion of the conversation on first half of the day. It moved progressively into an issue of dealing with misinformation and dealing with advancing diversity, equity, and inclusion. So that there was a lot of acknowledgement that in the renal space, you're dealing with, first of all, if we're going to go to the second issue there, diversity, equity, inclusion, I think there's a really strong amount of support amongst those in attendance that when it comes to diversity, it comes to equity and inclusion within the field of kidney disease and those impacted by kidney disease and kidney health. That is one of the strongest examples, I think, sometimes in modern society of where the system really and the whole society really falls a little short, and a large group of people fall into an area where there's a lot of inequity, and it's something that is very concerning. Misinformation went straight, of course, to many things, but it particularly went to the issue of vaccinations and how vaccinations are being dealt with. But at the same time, it was also a matter of not just vaccinations. It was also a matter of, is the public trust in the doctor and in the healthcare system, has it eroded as the public trust in other groups in our society has as well? And what does that mean? And they could see that as an issue in nephrology and also just in general. Sometimes how much nephrology is misunderstood by others in healthcare sometimes.
So I'm struck by your comment about misinformation, and it sounds like the American College of Physicians is exploring this issue. I know the American Board of Internal Medicine has a meeting in a couple of weeks that's focused entirely on this topic. At its recent meeting, the Council of Medical Specialty Societies announced that they were partnering with YouTube on an effort, related to um, information on YouTube and making sure that it's accurate. Where's this all going? It seems like there's a lot of interest around it and a lot of important players, but I don't see the path forward as to how to confront this issue.
I think you just summarized the conversation completely. Everyone understanding exactly what an important conversation this is to have and how difficult it is to impact, and wondering exactly where to go with this. And there's, you know, there was a healthy debate among, you know, where certain things, where there certain practices had invited more misinformation in our society. Is this truly the responsibility of social media on its own? And is this growing just kind of disconnect in some sections of our society about um, how to deal with science and just how to deal with things that there can be significant amounts of information and data to support what is being provided for you. And that is in that, you know, sometimes what is being counter offered just does not make sense. There was a bit of conversation as well about what do you do as you prepare in your society, your materials for publications, for your speakers at your meetings, and how do you address making sure that somehow the platforms that you support don't get co-opted by individuals who are providing misinformation intentionally.
So, as you listen to the discussion and as you have thought about this issue, what would your advice be to the ASN leadership as to what ASN's potential role in this arena would be?
Move with caution, but move with determination. The caution is, and you know, ASN did speak to this in the meeting, and the caution is that you know, you need to make sure that there's not a difference between misinformation and the fact that there is serious disagreement on something, and the part about moving with determination is that to protect the integrity of what you're providing in information and what gets published and what you provide platform for, because it's really critical at this juncture to make sure that we preserve the integrity of these institutions, ASN and others, and the access to information that they provide for both healthcare professionals and for the general public trying to follow what it is that they are saying.
So the final part of the meeting, I know, is always a focus on legislative and regulatory issues. And I imagine a lot of the conversation was, you know, that when Congress failed to pass the Build Back Better legislation, there are a number of other pieces of legislative priorities wrapped up in that sort of omnibus bill. So in addition to some of those conversations, I think mostly around the Affordable Care Act, what were some of the other policy-related highlights from that part of the meeting?
Well, you also have payment reform, which is beginning to, you know, is beginning to become more cyclical the way it had been, you know, a couple decades ago, and the efforts to delay various cuts in Medicare. In 2022, the first was a 2% cut delayed the first part of this year, a 1% for the second quarter of this year, and trying to basically provide a 1-year increase to offset neutrality conversion issues, which is part of the budget neutrality, kind of the whole structure within that, with a 3% increase. Last year it was a 3.75. Delay 4% pay-go cuts from 2022 and 2023. So these are really important financial issues that need to be dealt with. There were also in the workforce issues, for example, with the Build Back Better Act, there was funding for 5,000 new general medicine slots for physicians, and so, you know, that did not occur, and how to get back to that is another issue. Telehealth is continuing to be examined, and we are going to see exactly how that all works. There has been an extension of those waivers until the end of this year. And, there's also the whole conversation of the test to treat program at the White House for COVID and whether or not that's going to succeed and how that's going to look at. It's going to move forward. There's a lot there. And then there was one giant, gargantuan elephant in the room.
You can't leave me hanging. What was I think I know what it is, but what was the elephant in the room?
That would be the leaked Supreme Court draft decision on Roe v. Wade and issues of reproductive health for women. There's also, we're expecting also to see a Supreme Court decision that basically is going to strip EPA's emissions regulatory authority. But when you look at how explosive and volatile the issue is in Roe v. Wade, and the concern about where it spreads to other rights, but also what it sets up in terms of a battle. We are expecting a massive battle between the parties over who controls the House, which right now I would say leans towards the Republicans, and a good opportunity for the Republicans to take the Senate as well. But this does factor into that, and that's very clear. So we know that this is not a final decision, and that it could be an opportunity for the decision to be maybe dialed back a little bit. I don't think it's likely that it will change. If anyone was going to change, maybe Chief Justice Roberts might not sign with the majority, but they still have an insurance-proof 5 members who are ready.
So, David, why don't we end there? I think we probably in future discussions need to focus both on the policy implications of overturning Roe versus Wade, especially in light of how the leaked decision, to sort of the elements of the leaked decision. I do think that the potential impact on the midterm elections, and just to remind everyone, that's about a third of the governors, a third of the senators, and all of the members of the House of Representatives are up for re-election. So it's not an insignificant, it's a lot of potential change there. And then I think this final piece around what seems likely to happen in the policy arena, particularly the legislative arena, over the next couple of months as we get to the, say, 4th of July recess. So how does that sound in terms of an agenda for future discussions?
I think that sounds great.
Okay. Well, thank you, David.
Well, thank you, Todd.